this week is the week that you're going to feel very overwhelmed in lab. And I just want to go ahead and empathize with you about that and let you know that if you stick with it, it will get better. So you're going to be learning mostly the skull, but also the rest of the axial skeleton this week. It's going to seem really overwhelming and also completely arbitrary that we make you learn all of these little portions. So what I'm asking you for is a little stick-with-itness and also a little trust, because later on you will figure out that you learned all those bumps because I'm going to attach a muscle to them later. You learned that hole because there's going to be a cranial nerve that goes through it. You learned the other hole, so there's going to be a blood vessel that's going to go through it, right? But right now, it doesn't seem like it's relevant to anything, and it just seems like we're trying to be cruel. So it's going to be really overwhelming, and give yourself a little time and a little repetition, and you will be able to do it. In addition, as generally will happen in lecture, is if you give me a minute to catch up, I will be able to organize the stuff in lab, right, for you, so that it makes it a little easier to memorize. But there is going to be a lot of memorization. If at all possible, try to go to open lab this week, because that repetition with the skull will make it a lot easier. In addition, you probably don't have a skull at home, I hope. Do you have a skull at home? Don't know, okay. So if you don't have a skull at home, then make sure that you take advantage of that. Also, STEM Center has skulls there. So if you can't get into open lab, the STEM Center has skulls there. And I bought a whole bunch of nice ones. Spent $30,000 stocking the STEM Center last semester. This library has some stuff. I know they have skeletal system. And then the Jordan library also has those models as well. So there's lots and lots of resources, even if you can't get to open lab, but open lab is best. Anybody got any questions, comments? Everybody okay about lab? Okay. So with that in mind, we're going to finish histology at the beginning of next class period, and then I will be starting bone, as you guys will be working on bone. Bone in lecture is way shorter than it is in lab, so we'll be sort of working on bone as you guys are working on bone during those 2 weeks. Okay, so we were talking just generally about connective tissues last time, and we're going to do connective tissues today. So connective tissue, I'll remind you, I told you last time, is probably for most people the most difficult of the 4 categories of tissues. Because the connective tissues don't really look much like each other, and also there's not a consistent naming system. So what we're going to do today is I'm going to help you organize it and figure out the similarities so that you can figure out where it's categorized. First, let's talk about the basic organization just of a general connective tissue, and then when we end connective tissues today, I will do the same thing that I did at the end of epithelial tissues, which is how do you know when you're done studying a connective tissue? What are the feasible questions that you could run into with a connective tissue? Okay, so first, when you look at any connective tissue, unlike epithelial tissues in which you just basically had to find the cells, the apical surface and the basal surface, with a connective tissue, you really have to find 3 things. Cells, yeah? Stuff between the cells, and the stuff between the cells is composed of fibers, protein fibers, yeah? And then the stuff that is not protein fibers is called what? Ground substance, yeah? And ground substance, by the way, it's really so general a term, it's meaningless. Because what ground substance is really just anything that's not cells or fibers. But in blood, ground substance is 90% water. But in bone, it's mostly calcium crystals, yeah? So it really just depends on what tissue. So you don't really know anything about the ground substance unless you're talking about a specific tissue, okay? But let's go ahead and start with the categories of stuff that are found. So here's a generalized connective tissue. This is actually lucerareal connective tissue, just a stylized version of it. So when you look at any connective tissue, you have to identify the cells, and the cells fit into 3 categories. Either you have an immature cell that's usually active in either cell division or making matrix, and an immature cell has the suffix blast, okay? And you've run into blasts as you've been learning histology. In dense, regular connective tissue, for instance, the cell is called a what?
Cytoblast?
Nope, not cytoblast. Fibroblast. And let's see why that makes sense. Because this is dense, regular connective tissue, and it's mostly what? Fibers, right? So fibroblast is a pretty good bet. Does that make sense? Okay. Note to self, fibroblast is the most common cell you're going to run into in connective tissue. So if you can't remember, guess fibroblast. Right? I'm not saying it'll always be right, but there's a pretty good chance that there's a fibroblast in that tissue because it's connective tissue and they have fibers in them, right? So fibroblast. All right. Now we haven't run into this, but in the next set of notes I'll teach you osteoblast, which is the bone precursor, right? When we're actually looking at bone in detail. When you have a mature tissue and you're less active in cell division and less active, not inactive, but less active in making matrix, then the suffix is usually site, okay? And so site is kind of the most common suffix that you're going to run into. Like, for instance, in bone you run into an osteocyte, and cartilage a chondrocyte. In adipose, adipocyte, right? Okay. So those are just kind of the most common cells that you're going to run into in almost any tissue. And although we don't run into them in this set of notes, we will throughout the semester. There are, of course, also clasped cells, and clasped cells are cells that instead of building up matrix, usually break down matrix or destroy matrix, which sounds negative until you realize that that's actually part of like remodeling a tissue, right? If you remodel anything, you have to do destruction and construction. These are the ones that do destruction. So for instance, we will run into, in bone, we're going to run into osteoclasts. Does that make sense? Okay, so in addition, one last little tidbit is that it's really, really common in connective tissues, especially in loose connective tissues, for cells to wander into the tissue because there's lots of space in there. So don't be at all surprised that in many, many connective tissues, you have white blood cells that wander into the tissue. It's a really good place to put a white blood cell. If you think about it, immediately deep to like an epithelial tissue, you're going to have a connective tissue, right? There's no room in the epithelial tissue for a white blood cell, right? Not really any room in there. Plenty of room in the connective tissue underneath, right? So what you have is you have white blood cells that wander in there, and they're kind of like sentinels, right? They're looking to see if anything actually gets through the epithelial tissue. Here's one right there. That's a macrophage, which is a big old lumbering white blood cell that whoops up on anything that looks weird. Okay? That's a macrophage. So don't be at all surprised that you see white blood cells kind of wander into connective tissue. Okay. All right, so there's also lots of extracellular material in connective tissues. Matrix is extracellular material. It is composed of ground substance and protein fibers. Back to ground substance for just a second. If you look here, anything that is not a cell, not a fiber, and this one happens to also have a blood vessel, any of this stuff is ground substance. And like I said, you don't know what's in the ground substance unless you are specific to a tissue. But it's usually like dissolved solutes in greater and lesser amounts of fluids. They got some ions in there, maybe some proteins and sugars in there. It depends on what tissue it is. So that's a really general thing. The amount of water in the ground substance has a lot to do with the texture of the tissue. More water, squishier tissue, right? Less water, more solid tissue. Okay, and then of course the protein fibers, and we'll be looking at the protein fibers as we move through. So 3 different categories of protein fibers that you primarily run into. The collagen fibers, we're going to see these several times today. Collagen fibers are long, relatively thick, and they don't branch. They are quite often pink, but don't depend on color as any primary indicator. Do not get dependent on color, okay? There are tons of different staining techniques that you can use to stain tissues. In addition, somebody can also show you a black and white image, so never use color as your primary determinant, right? You can use it as a check mechanism, right? But never your primary determinant. So these are collagen fibers. They don't usually branch. Here are collagen fibers, right? Okay. So they don't usually branch. They're long, skinny, and they're really, metaphor for a collagen fiber is it's kind of like if you took a rope, right, and you separated it into the individual fibers that make a rope. the individual fibers wouldn't be particularly strong, right? They're also not very stretchy, right? They don't stretch. But as you start to bundle them, right, you can get a lot of strength out of them. That's how you want to think about collagen fibers. They're like rope fibers, okay? They are made, of course, of the protein collagen. And although people argue, you have in your body between 30,000 and maybe 80,000 different kinds of proteins, but 25 to 46% of those are collagen. So it's by far the most abundant protein in your body, okay? And it is stress resistant. If you bundle it, it gets stronger. Its primary job is to like resist gravity and hold things together, right? So that's what it's doing. It's also part of the aging process. So the aging process, what collagen is doing its best at is holding you up against the onslaught of gravity, which is continually pulling things down, right? And then as you age, what happens is you start to see the effects of the fact that gravity will win over collagen every damn time if you give it long enough, right? So these wrinkles that I have here, I didn't have when I was 16. And why? Because what happens over time is that you break the collagen fibers, right? And then you just don't replenish them as much as you age, right? Your collagen synthesis will slow down as you age. And that's part of the nature of aging. And of course it happens everywhere. People always notice it with women up here, right? But men don't think we don't notice. It happens down there too, okay? Happens everywhere, right? So collagen is involved in the aging process. We will talk about it when we get to skin. But there are a few things that you can do that will allow you to keep your collagen fibers longer. There are a few things that you do that dependably break down your collagen fibers. Anybody know what those are? What makes your skin age just dependably? Sun and smoking. Alcohol, small amounts of alcohol doesn't do a damn thing to your skin. Large amounts of alcohol will trash your skin. Yeah. So yeah, if you're excessive about alcohol consumption, it definitely trashes your skin. But smoking. We don't tend to have a whole lot of smokers in Utah. It's like one of the things that I like about Utah. But when I was putting myself through college, I worked in restaurants and bars. And in Texas, you're still allowed to smoke in restaurants, which just seems crazy to me now. But so the first question was always smoking or non-smoking. I literally don't have to ask you whether you smoke or don't smoke. If you're above age 22 and you are a smoker, especially if you are a woman, I can tell all over your face because it completely destroys the collagen in your skin really, really quickly. So that's like the way that you can appeal to people because everybody thinks, I'll never get cancer, but they know that ugly is equal opportunity, right? Ugly can happen to anyone. Anyone, and we're all vain. Okay, so that's collagen fibers. Elastic fibers are thinner. They usually stain really dark blue, dark purple. They may look black, okay? And if you watch one for long enough, you may see it branch. Do you see this branch right here? You don't always see them branch, but you may see them branch. And collagen fibers really don't branch. They're springy and flexible, but they're not as strong as collagen. However, if you bundle them, they can get strong. So the metaphor I use for these are like those tiny elastics they use for your braces, right? One of them isn't very strong, but if you bundle them together, right, you can get a lot of strength from a lot of elastics together, right? That you've seen that, have you seen that challenge where they keep putting rubber bands on a watermelon until it pops? I totally want to do that, but I want to do it at somebody else's house. Because I don't want to clean it up, man. So rubber bands, eventually they can generate so much tension that they can actually cause that thing to, I'm going to do it this summer. What am I talking about? Those are elastic fibers. Elastic fibers are not individually strong, but collectively they can have a decent amount of strength. Okay, and then last but not least, these are present in a lot of tissues, but they're hard to see because they don't stain very well. These guys right here are reticular fibers. Reticular fibers are actually made of collagen, but stick with me here. Take that individual rope fiber that you use as your collagen metaphor and separate it into the teeny tiniest fibers that form it, yeah? used those fibers to form a really, really loose hairnet. So you had rope, elastics, and then a hairnet. Now, the hairnet is not very strong, right? But it can hold a loose framework of a soft, squishy thing. And you use it to form the internal framework of soft, squishy organs like the spleen and the liver and some glands. So think of it as loose internal scaffolding that you could use, right? So like an internal hairnet, right? It's not really, really rigid, but it holds this loose shape. Does that make sense? Okay. So that's what reticular fibers. They're in a lot of tissues, but you only label them in one, right? Just because they don't stain very well. Okay, now let's get into our types of connective tissue. Our types of connective tissue. So remember what we said last time? We said that even though they don't look alike, why are all these tissues considered connective tissue? What do they have in common? Yeah, they're all derived from mesenchyme. So they're all derived from this embryonic connective tissue called mesenchyme. Note, I will not ask you to identify a histology image of mesenchyme because it's just a mess, but I'll show it to you anyway. Okay, so mesenchyme, here's what mesenchyme looks like. So they say that there are fibers in there, but I don't know. Can you squint and see a fiber? I can hardly see anything. The only thing I could tell from this picture is it's definitely not an epithelial tissue. I can tell that, okay? But other than that, I couldn't tell much. This is the other embryonic connective tissue. This is called mucous connective tissue. It's not quite as common. So all connective tissues are like derived from these, mostly mesenchyme. So this is the embryonic connective tissue. I won't ask you either of those, but I will ask you the adult connective tissues. And the adult connective tissues remind me what the categories were. What were they? What was? Areolar? Not yet. There were three big categories. The one that includes blood is called fluid connective tissue. And this one, that's the solider ones, supporting, okay? And then this one, that's the squishy ones in between, proper, connective tissue proper. So we're going to start here. Remember, there was a subdivision of connective tissue proper, and it was loose versus dense. But I want somebody to tell me in your words, what is loose versus dense describing? Ground substance versus fibers, right? If you have more fibers than ground substance, then you are dense. More ground substance than fibers, you are loose. Yeah, got it, exactly. So we're going to do 3 loose, 3 dense. Good? Okay. So the loose connective tissue, they're usually pretty vascular. They've got loose fibers, dispersed fibers. They're good packing material, so let's meet these. The first one is called areolar, or sometimes areolar loose connective tissue. Sometimes they use both words. So that's this one. Make sure you know this one, because this one has so many things that you could label in it. Okay, so areolar or areolar loose connective tissue has all 3 types of fibers in it. Although nobody will make you label reticular fibers, they're in there. So conceptually, you would have to be able to know that, right? So if I asked you a multiple choice question and said which fibers are present in areolar loose connective tissue, and I put collagen, elastic, and reticular, and all of the above, you would choose all of the above. However, if I showed you a histology slide and I pointed to this guy right here, what fiber is that? Collagen, right? And then the long skinny ones that just look like maybe pen marks, those are elastic, right? Okay. So I'm not going to ask you from a histology slide something unreasonable to label, but you do have to conceptually understand what's actually in there. Okay, of course, you can see ground substance really easily in this tissue. There's a lot of ground substance visible, okay? The ground substance is mostly fluid, by the way. It has a bunch of different kinds of cells in it, but you are not at the level in your education in which you can really distinguish between the different kinds of cells. You really aren't. So you can do one of 2 things. I don't really care which one you do. You can either call them fibroblasts, because that's what most of them are, or you can call them interstitial cells, which means they're in the interstitial fluid and I don't know how to identify them yet. That one's more true. The other one you could also do, okay? But fibroblast is pretty safe. But you know, this one isn't a fibroblast cell. That one's not a fibroblast cell. That one's not. And you don't know how to identify them yet, so it's fine. Either one is fine. So the most abundant type of cell in there is a fibroblast cell, but there's also some adipocytes in there. There's also mesenchymal cells in there. There's also white blood cells in there, but you can't do that yet. Not quite ready for it yet. Okay, so this is a super duper common tissue. It's the most likely tissue that you will find under an epithelium, okay? So if you want to feel what it's like, guys, grab your skin and just pull up, especially in an area where you don't have very much body fat, right? Okay. Do you see that it's got some give to it, right? It's also got some snapback. So it's got collagen, right, and elastic fibers in it, and it's got some movement to it. That is what areolar tissue is, right? Okay. So areolar connective tissue. This is gross, but if you've ever skinned anything, whether it's a fish or a human or a deer, I don't know what the hell you've skinned, or a chicken, you can actually naturally see the separation between the skin and the muscle, and you can easily pull one away from the other. And if you're watching, you can see the fibers popping when you do that. What you are seeing is these fibers popping because you are actually pulling the areolar tissue apart to separate the skin from the muscle. Does that make sense? Okay. That's where the areolar connective tissue is, and it's a whole bunch of collagen and elastic fibers. Good? Okay. So that's areolar connective tissue. So this is the glue of the human body. Like I said, it's found under most of your epithelial tissues. It's found deep to the epithelial tissue in your blood vessels, around your nerves, your lungs, your bladder, your muscles, your lymphatic. If you've ever heard the word fascia, have you heard the word fascia? Fascia is almost always areolar connective tissue. Sometimes it has a little bit of dense irregular with it too, depending on where you're talking about. But it's almost always areolar connective tissue. Like if you're pulling two muscles apart, or if you damage some fascia between your muscles, it's almost always this tissue. All of your mucous membranes have this tissue deep to them, all of them. So this tissue, if I were a student, I would make sure that I could identify almost everything about this one because, of course, it's really common and you can see damn near everything in it. Okay? Okay. Now, if you want to understand why adipose, oh, by the way, can you recognize that this, even though you might not have seen the figure before, can you recognize that this is areolar, loose connective tissue? Yeah? How about this one? Different color, staining, but can you see thick fibers, thin fibers, and the suggestion of cells, right? Right? And by the time you get used to it, the process of elimination, it doesn't look like anything else that you learned either. So you can definitely get used to it with a little practice, okay? All right, so the one that doesn't really look like any of the others is really adipose connective tissue. It doesn't actually look like a loose connective tissue because I need to describe to you what you're actually seeing. So with adipose, what you're actually seeing is, let's go back to this picture for just a second. So this was a stylized drawing of areolar, yeah? Okay. But what I want you to imagine is this person is going to get fat. Because isn't areolar in the same place where, for instance, subcutaneous fat would accumulate? Yeah? Okay. Not everywhere is the same, but it's in the same place that you would have subcutaneous fat. So if I do this right here, hardly any body fat right there, right? But if I do it right here, in almost all women, there's some body fat right there, right? Do it right here in almost all men, there's some body fat right there. Different body fat deposition patterns based on estrogen and testosterone. Okay, so the reason that adipose, even though it doesn't look like a loose connective tissue, is a loose connective tissue, is adipose is actually this one plus cell division with adipocytes. So what happens between Halloween and New Year's Eve, yeah? You got a lot of energy in and not a whole lot of energy out, is that you start storing it up. Yep, that's where this came from. This was like that month right there. I didn't have that before, dang Little bastard. So what happens is you take this tissue and you start doing so much cell division with your adipocytes that you end up pushing all of that other stuff that's in there between the cells. So here's your adipocytes. They started going through cell division. What is between them that you can't see anymore is a whole bunch of other kinds of cells, right? Your mesenchymal cells, you got some blood vessels going through here. And what you're seeing is it gets so full that you don't see anything but the adipocytes. But there's still collagen fibers, elastic fibers, reticular fibers, and a bunch of other cells in there. So it ends up looking very different than your other loose connective tissues. It looks kind of empty, but it's not empty. What it is mostly cells that are full of something that doesn't stain. What they're full of is a big fat droplet or a lipid vacuole, which is where you stored your mashed potatoes. Right there, okay? So what happens as you start to gain weight is your body goes, hey, we don't have enough storage space. Let's go rent a new storage unit. It's like, you don't have to rent one. I'll just make one for you. And I make some more storage units for you. And then it fills it up with your lipid vacuoles, right? And you fill these up. But since a lipid vacuole is lipid and you use water-based stains, the whole damn thing looks empty. But it's not empty. It's full of fat. Does that make sense? Okay. So it is a loose connective tissue that has gone through boatloads of cell division, so that mostly what you are seeing is this cell right here. If you look right here, everything but the vacuole got smashed up to the side of the cell, right? So here's the nucleus and the cytoplasm and all of the organelles. They're all right there, right? The rest of it is all lipid vacuole. Does that make sense to you? Okay, so that's why this tissue that doesn't really look like the other loose tissues because you can't see the fibers and stuff, that's why it actually is categorized as a loose connective tissue. So adipose goes here, okay? So let's talk about adipose, our friend. So adipose is a specialized type of connective tissue primarily for energy storage, also for padding. It's good for padding. Has very little visible matrix just because it's so packed. It's really, really vascular. It's got a whole bunch of blood vessels running through it. Here's one right here. Here's one right here that's running through it. The cells are called adipocytes. Each cell has what we call a signet ring shape. Do you know what a high school ring, if you looked at it from the side? Skinny on one side except the little lump on that side. You know what I'm talking about? A high school ring. So they have that shape because everything gets pushed up to the side, all of the organelles and stuff. And the way that adipose gets laid down, especially subcutaneous adipose, is it doesn't get laid down in a nice even layer. It gets laid down in a lumpy layer in little lobules. So as it gets laid down under your dermis and where the areolar connective tissue is, it gets laid down kind of lumpy in little lobules. And then, of course, if your skin follows the lobules, what does it look like? Cellulite. Yeah, it looks like cellulite. And of course, you're more likely to have cellulite if you have more adipose. But skinny people have cellulite too. They do, right? And also there's some genetic predisposition to cellulite. You're more likely to show cellulite if you have thinner skin. Yes? And also estrogen predisposes you to make cellulite and also to shave your legs so that your cellulite will show. You could get hairy and then nobody would notice. It's an option, all I'm saying, right? So that's what that's all about. Now, how do you get rid of, after you made your storage, how do you get rid of it? Well, here's the tragedy about adipose, is that after you go through cell division and make more adipocytes, you keep them forever. And it's much easier to fill up your storage space when it's already made. So you can't get rid of the adipocytes that you have. This is important for those of us who are parents for a couple of reasons. Don't let your kids get fat, because then they are going to battle weight their entire life. I'm not talking about toddler chubby. You know they're supposed to be chubby, right? You know I'm talking about fat children. Go to Walmart, you will see them. Okay? You know you will. We all know Walmart. Okay. So, because then you are going to give them a lifetime of battling weight. So, and then of course it also matters for moms, because one of the things that happens during pregnancy is this little cletus, the fetus, who's your internal parasite, is exceptionally good at making sure that resources are going to be available for it, right? So they release hormones that slow down your metabolism so that you will store things up just in case you don't feed it as often as it wants to be fed, right? So one of the things that women tend to run into is that before and after pregnancy, your weight management is different, isn't it? Right? Even if you didn't gain a whole hell of a lot of weight during pregnancy, right? Still, it is easier to gain weight after pregnancy, right? Because you actually have more adipocytes. It's harder to maintain your weight after pregnancy because you have more adipocytes. Does that make sense to you? And it's really like evolutionarily a pretty stable strategy, but it does make you go, damn it, and tell them when they don't buy you a good Mother's Day present. You're like, this to you. Right there. Maybe a couple of donuts, but mostly you. So, now what's the only way that you can truly get rid of adipocytes after they've gone through cell division? Liposuction, yeah. And liposuction is a really, really inexact science. Need to go ahead and tell you, it's probably not going to work out exactly the way you expected it to. So liposuction is the process of like sticking a freaking vacuum cleaner under into the subcutaneous area. So I know about this not personally, but my best friend had liposuction done. She was about to get a divorce, and she's like, I'm going to fix all this, right? I'm going to get, little aftermarket upgrades, go back in the job market, and then she's like, oh my God, people send me pictures of penises. I was like, I could have told you that. Because she's in her 30s, and I was like, they sent you what? I'm so glad I'm not dating. I'm never dating again. If I get divorced, I'm just like, well, I'm done. Apparently, I'm going to live with my dogs. Okay, so what she had done was she didn't like these. So she had liposuction done right here, right? Sucked it out right here. Really happy with it. Till the next time she started to gain a little weight. And it's easier to fill up the storage tanks that you already have. So what happened is she gained weight differently than she did before. And where she gained weight is instead of having this part of her butt, she gained a top butt right up here, right? Big old top butt right here, like an extra one, right? And she's like, I totally liked my bottom butt. I was like, I told you that was going to happen. She didn't believe me. So now she has to battle two butts. She's got a double butt layer. Go ahead.
So I know a woman who did that as well, but she got liposuction all over her stomach, legs, butt, everything. And when she gained it back on her neck, she got like a goiter.
Like a bullfrog neck.
Uh-huh.
What can you do with that? Wear turtlenecks all the time? There was nothing, right? You could sit right here and you wouldn't even see your butt, right? You'd be okay. Yeah, I'm not a big fan of liposuction. Somebody needs to perfect that before I would consider it. Okay, so adipose. Oh, by the way, this one last little thing about adipose is that there's a hormone that we've discovered, I think 15 years ago or so, but in the last 5 years it's gotten into clinical usage. Leptin is a hormone that is released from your digestive tract, and I'm pretty sure it's actually released from your adipose tissue, and it communicates to your brain when you're satiated, when you're full. Okay? That makes sense? And all of us release it. Not all of us release the same amount or as quickly or are as responsive to it. And so they figured out that you could use this to potentially treat obesity. It is not just given to lose 15 or 20 pounds. It's generally used to treat obesity. And what it can do is tell you that you're satiated. But guess what else, which is just a minor change that we could all choose to do, that will allow your leptin time to get back to your brain? Yeah, just eat slower. People who eat more slowly tend to consume fewer calories in any given meal. And although that's not going to make you lose 25 pounds in a month, over 6 months, it could make a decent amount of difference if you just slow down and allow your leptin time to get back to your brain. So that is associated with lower weight. Okay, last of your loose connective tissues is reticular loose connective tissue. And reticular is similar to areolar in its look because it's got like lots of visible ground substance, but it has only reticular fibers in the matrix, okay? And it's got a bunch of different kinds of cells in it, including fibroblasts and a whole bunch of leukocytes. But you don't have to label the leukocytes. But all of these fibers are reticular fibers. So that's the tissue that you can label it in. And this is also reticular connective tissue. So it just kind of looks like a bunch of branches and a few visible fibers within that. Does that make sense? Okay. So where would you find this? This would be the internal, like, soft framework for the spleen or the liver. That's where you'd find that. Good. So that's the last one here. Okay, and then the dense connective tissues, they're pretty easy, I think. They all look dense to me. Let's look at the three of them so that we can make sure that they all look dense, okay? Obviously, dense. Far more fibers than ground substance. Dense, far more fibers than ground substance. Still dense, right? And dense, right? Okay. So these dense connective tissues, there's three different types. There's dense regular. Now, we're looking at dense regular here. You already know why it's dense. Somebody tell me why it's called regular. Yeah, because they're all parallel to one another. It's very nicely organized. This tissue has so many fibers that, are you surprised that the cells within it are called fibroblasts? You shouldn't be. So many fibers that those are called fibroblasts. Okay, this is the tissue that is you're most likely to confuse with smooth muscle. The difference, though, if you look at it and just think about it and then check it later, is that with this tissue, obviously the cells are smashed between the fibers, yeah? But with smooth muscle, the cells are within, the nuclei are within a cell. You can actually see a cell surrounding it. Even though it does tend to have the same wavy look, right? The cells are around the nucleus instead of like between these fibers. This tissue is going to be really strong in this direction, right? But not strong in that direction, okay? This is what you use to make ligaments and tendons, and you told me before, but remind me again, what's the difference between a ligament and a tendon?
Connecting muscle to bone.
Muscle to bone is a tendon, and bone to bone is a ligament. They're the same tissue, just used in two different places. And almost all ligaments, not all of them, and tendons are made of this dense, regular connective tissue. It's not stretchy, and you don't want it to be. It's not stretchy because if you, for instance, I was going to use my biceps brachii to pick up this water bottle, right? What I need is the biceps brachii is going to contract, and it's going to pull on the tendon that's attached to the bones of my forearm. If this were elastic, can you see that there would be a lag time between muscle contraction and actually movement of the forearm? So what would happen is you would end up with a lag time, and then it'd snap back and hit you in the face. So you don't want them to be stretchy. But of course, it also means that if you hit them from a direction that they didn't expect, then they could break because they don't really have much pliability to them, right? So you can tear a ligament or a tendon, but they are not supposed to be stretchy. They're really like ropes. So ligaments, tendons, and then one other word that's associated with that is aponeurosis. You may have never met this word before, but in aponeurosis, instead of using a ligament or a tendon like a cable or a rope, you can use it like a sheet. So this muscle up here is my frontalis muscle, and then the one back here is my occipitalis muscle. And they need to connect those to each other, but I don't want to use a whole bunch of ropes, so I use a big flat sheet. And that a flat sheet of tendon is called an aponeurosis. And you've got one here, and you've got one right here covering your abdominal muscles. You'll run into those as we run through this semester. So that's an aponeurosis. Okay, so that's dense regular. Here's dense irregular. This is the picture that your textbook uses, but I like this one best. Here's my favorite picture, because this one is actually showing you bundles of collagen going that direction, right? And then cross sections of bundles of collagen going the other direction. So you can see that it's like a hammock, right? It's making this really, really strong tissue in a bunch of different directions. So this is dense, irregular connective tissue. What protein fibers are these? Collagen. What would you call the cells if you had to guess? Fibroblasts. Those are fibroblasts, exactly. And this tissue is used in areas in which you're going to yank on it from a bunch of different directions, not just like this direction. So you're going to use this tissue around the outsides of all of your bones to attach muscles to it. Because if you think about your femur, I'm going to yank on my femur this direction, that direction, this direction, right? Also that direction, right? I'm going to pull on it. So the outsides of bones is covered with what we call periosteum. And the superficial layer of periosteum is made of dense, irregular connective tissue. Also perichondrium around cartilage. Also this. So we did this and we said that this was a reeler, right? But if you do this, try to stretch it, you'll see that it doesn't have much stretch, right? That is dense irregular. It's the dermis of your skin. It's made of dense irregular. Does that make sense? Now, again, you gotta get a little gross to make your point. You have experienced dense irregular connective tissue because we use the dense irregular connective tissue of other mammals to make leather. Yes? We moisturize it, stretch it, tan it so that it's pliable but strong from a bunch of different directions. That's what leather is. Dense irregular connective tissue of another mammal. You can also make it from like some reptiles. People have made it from other people too. We will talk about that when we get to the skin. Please don't do that. Okay? It's illegal and also unethical. Let's not do that. So this is dense irregular connective tissue, the dermis of the skin. This is also dense irregular connective tissue. Yeah? That one is as well. Okay, and the last but not least with the dense tissues is elastic dense connective tissue. I put dense in there. You can just call it elastic connective tissue, but I call it elastic dense to keep it organized and separate from elastic cartilage, for instance. Okay, so elastic dense connective tissue looks like a freaking mess to me. Okay, so we had dense regular, dense irregular, and then elastic dense connective tissue. Okay, so this one, it's really hard to see anything but the fibers, if you ask me, with this tissue. The fibers are all parallel elastic fibers, that's why it's so dark, right? So this one's going to have both strength and elasticity because you've got so many elastic fibers running together. Does that make sense? Right? So this is elastic dense connective tissue. They have a fibroblast nucleus labeled there, but I would never do that to you because it just looks like one of many blobs. It doesn't, I mean, that's arbitrary. You're like, sure, okay, that's a fibroblast nucleus, right? But you can't really tell what the hell is a cell versus a fiber there because it's just a mess. But you can definitely say, okay, these are elastic fibers. They're all running parallel to one another. It's going to be stretchy and strong in this direction. So what do you use this tissue for? A couple of different places that'll make sense to you. First, your vocal cords are made of this. They need to be strong but also have some stretch to them, right? Is that good? The ligaments between your vertebrae need two things. They need strength like every ligament does, but they also need stretch, right? So those are your elastic ligaments between your vertebrae. And then you also use them for the elastic ligaments that hold up the penis during an erection. So erections, as we will discover later this semester, are primarily a hydraulics thing. But then they also have ligaments that hold them up. And we want the ligaments to have a little give to them, don't we? Because you don't always go from the same angle. Let's hope. Right? On a good day, always from the same angle. And they need some give. So the elastic ligaments that hold up the penis are made of not dense regular connective tissue, but an elastic dense connective tissue. And that's probably the one you'll remember. Go ahead.
Ligaments connect bone to bone, right?
Yeah.
But there's no bone in a penis?
There is no bone in the penis. There is also no muscle. That skeletal muscle that you're talking about, so they are arbitrarily called elastic ligaments. There's also no bone here in the vocal cords. Okay. But it's not muscle, not connecting to muscle. It's specifically.
Oh, no,
It's
that
connecting
makes
to
sense.
another connective tissue. It's really connective tissue to connective tissue. To like clarify, but that was a good question.
Actually, still
And
like
there
break
is,
it.
if you were a different mammal, you would have a bone in your penis. Raccoons have bones in their penis. Whales have bones in their penis. When you're confused. When I was taking zoology, I had a really funny professor who used the baculum, which is the penis bone, of a whale as his cane.
That's
He
amazing.
did.
But how do you break it then on a human?
You can break your penis, but you don't break the bone. What you do is there's these hydraulic chambers, right? And if you really get all crazy,
I mean, I don't know from first experience, but
my same best friend, who is the source of all entertaining stories in my life, because if you want somebody to do something but you don't want to actually risk yourself, you just say, hey, will you do this and tell me all about it? She broke her boyfriend's penis right after she got married, right after she got divorced. It was like boy number 2, and I was like, oh my God, you're a menace. So if there's inflatable chambers, and if you damage the connective tissue around them, you can actually cause like internal bleeding until it repairs. So it does repair, and I got a complete like story
I just know they have
with photos.
They just have physical therapy for it, so.
They do have physical, and you can break your penis, but there is no bone in there. And I always put that, by the way, I always put the penis bone question on your final exam, and people still think there's a bone in your penis, right? I always do. There's a jointed bone in your penis, and that's how you get an erection. And people are like, that's got to be true. And that's what abstinence-only education gets you in Utah. Okay, it's true. It's true. I'm like, you're going to be so disappointed. Sorry. Okay, so now let's get into the supporting connective tissues. So with the supporting connective tissues, that includes cartilages and bone, right? How many cartilages do you have? 3. Where did I put my pen? There it is. Okay, so there are 3 cartilages. Let's put bone over here because there's only one. And there are cartilage. And 1, 2, 3. Cartilages are easy to identify if you get used to looking for one identifying characteristic. And that is that the cells have a big frame around them called a lacuna. So let's talk about cartilage in general and how you like know what a cartilage was kind of like. Cartilage, now we're getting into the semi-solid tissues, right? And then almost solid, bones almost solid as well. So they're going to be semi-solid. They're going to be semi-solid primarily because they have a whole bunch of like collagen fibers in the matrix, so many that it ends up giving them a lot of structural stability. So you probably have accidentally gotten cartilage in your mouth when you ate meat at one point, and it's just like, and it's like not going to break down at all. And it's kind of gross to think about, of course. But in addition, a metaphor for you is, have you ever left Jell-O uncovered in the fridge for too long and it gets kind of springy? Okay, that's what cartilage is like. And that's actually what Jell-O is made of. Did you guys know this? So Jell-O is made from boiled down connective tissues of other mammals, which then you reconstitute in solution, and all of those fibers make a matrix, right? And then somebody decided to make that into a tasty dessert, which I have so many questions about how that occurred. So that's what Jell-O is actually made of. It's made of like all of those fibers that are just not soluble, so they stay, and then you reconstitute them and you can put them. So that's what Jell-O is like made of, and it's got that same kind of texture. But I want you to imagine, because we're in Utah, then instead of just making Jell-O, you make a Jell-O salad, right? And you put some grapes in it. Do you guys know that that's a thing in Utah?
Oh, yeah.
Okay.
Jell-O is the state food.
I would also like to tell you that nobody wants you to bring that to the potluck. They want you to bring queso. Stop bringing Jell-O salad. It's grody. Nobody is like, oh, Jell-O salad, yay. Unless you're 80, you're not excited about it. Okay, so here's the deal with the Jell-O salad. Remember how it's got the grapes, right, in it? If you pulled the grape out, there would still be a place where the grape sat, because of course it's a semi-solid matrix. That place where the grape sat is going to be the place where the cell sits, okay? Only with cartilage, the grape was there first. The cell was there first, and it makes the matrix around itself, and it leaves itself a little house, a little space to sit in. You with me? So here's my grape, right? Here's the space that it sits in. Here's another grape, space that it sits in, another one, okay, right? Out here is what? What's that? That's the matrix. What's in there? Collagen fibers. Even though you can't label them all the time, they have to be there. They're actually what provides the like gelatinous nature there, right? And also some fluid, right? That's where the matrix is. And then the cells, if it's cartilage, the cells are called what? Chondrocytes. And what's the little space that they leave for themselves that gives them kind of a frame? Yeah, it's called a lacuna. And plural is lacunae. That's a little lake. A lacuna is a little lake. So let's look at all three types of cartilage and make sure that you can tell that it's cartilage by looking for that frame around the cells. Ready? Okay. So you should be able to identify it as cartilage first, and then you can just figure out which kind of cartilage it is. Okay. So do you see the frames around the cells? You do, right? Okay. Do you, even though you haven't seen this one, do you see the frames around the cells here? Yeah? How about here? You see the frames around the cells? Yeah, you can see them, right? How about here? Can you see them? The cells have bright, this is the cell right here, right? Now sometimes the frame is far larger than the cell, and sometimes the cell almost completely fills it up. It kind of depends on how much the tissue desiccated, right? How about here? You see the frames around the cells? And how about here? Yeah? So if you get used to it, the cells are really distinct in cartilage because they have a frame that's surrounding them. And what do I mean by frame around the cells? Well, look at the difference between that one and like this one. Do you see any frames around the cells here? No? How about this one? No, right? So cartilage gets to be pretty easy to identify if you let it. Okay, and then there are three different categories of cartilage. The first one is the most common type of cartilage. This is called hyaline cartilage. Hyaline means glassy because the matrix does not have visible fibers. Look at that one versus this one. Do you see all those visible fibers? And this one, right? Okay, glassy as in a nice smooth matrix. That is hyaline cartilage. So let's go back to hyaline. Okay, so this is hyaline cartilage. Now, it does have fibers in the matrix and they are collagen, but they don't stain, so it looks glassy, right? So this one is the smoothest looking. Now, even though this one is unfamiliar, can you tell if you look over at this side, because this is actually a different kind of tissue. If you look over at this side, which type of cartilage is it? That's hyaline as well, yeah? Hyaline is a really common cartilage. It's between most of your bones. They call it articular cartilage when it's between your bones. It is the costal cartilages that you use right here to connect your ribs to your sternum. It's the cartilages that are in your trachea, right? And your larynx. It's this cartilage. If you really want to feel it, run your fingers down your nose and then squish, right? Not the skin part, but the part right after the bone that has some give to it, right? That's hyaline cartilage, okay? Now, hyaline cartilage also used to form the vast majority of your skeleton when you were a fetus, right before bone formation occurred. So almost your whole fetal skeleton was hyaline cartilage at one point. Good? Okay, so I want to compare and contrast that one with this one. And this is elastic cartilage. What about this picture would make you think it was elastic cartilage? Yeah, so you can tell it's a cartilage because the cells are framed, right? The cells really pop out in a cartilage. And then what type of fibers do those look like? Elastic, exactly. So elastic cartilage. So elastic cartilage is not super common in the body. It exists in the epiglottis, that little floppy thing back at the back of your throat. And it exists in your internal eustachian tubes, but the place that you can really feel it and you can feel the difference is if this is hyaline cartilage, this, bing, 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 it's more boinky. That's the elastic cartilage right here, okay? All cartilages, by the way, have really, really poor blood flow. So they're really bad at regeneration. If you damage a cartilage, it's probably still damaged. Does anybody have a knee damage, cartilage damage? There's usually somebody. Yeah, is it still damaged? Yeah. It might have gotten a little better, but since they have really poor blood flow and they're really thick, they have pretty low likelihood of complete regeneration. That is because it is avascular here. The only place that it gets blood flow is from the tissue around it, but it's too thick for good diffusion. So if you damage cartilage, you're only likely to get any regeneration at the edges, not all the way through the middle. That's why for those of us who at one point pierced this part of our ear, yeah, this part, it's still got a hole in it, doesn't it? Yeah? Even if it's not like through the skin, you can still feel it. So I got a hole in this side, and I fell on a coffee table on this side, and both of them I can still feel. It's also, by the way, the reason that nose jobs work. Why would you do a nose job if it was regenerative tissue? It'd just grow right back to your ugly ass nose that you had before, right? So what they do is they shave down the cartilage. Can they reshape the bone? A little, but not much, and bone is super regenerative. So good luck with making it regenerate the way that you want it to. So they just change the shape of the cartilage and then let it heal and let the swelling go down and hope for the best, right? And you never really know. Do you know anybody who's gotten a bad nose job? Because it's permanent, right? My husband's ex-wife, Karma, has had 3 bad nose jobs, and now I don't think she can stand in the rain without drowning. Still Karma. Deserves all of it. Okay. And then the last of the cartilages is fibrocartilage. Fibrocartilage is right here. So let's go hyaline, elastic, and fibro. Okay. Hyaline, elastic, and this is fibrocartilage. Fibrocartilage, you want to get into the habit, but don't, of identifying it as always blue. It's usually blue because it stains best with this blue stain, but there are a couple of other ways that you can see it. So what are the ways that are dependable that you could identify fibrocartilage? Parallel fibers with obvious chondrocytes, right? Your cells have a nice frame. Does that make sense to you? Okay. Parallel fibers. These fibers are all collagen. This is your strongest cartilage. Here's the other fibrocartilage picture for you. Okay. Parallel fibers with really distinct cells with frames around them, right? So this is a really strong cartilage. You put it in places where you need a lot of strength and a lot of resistance. So intervertebral discs, the disc between your vertebrae, those are fibrocartilage. Yeah? Your TMJ joint, your temporomandibular joint right here, that has fibrocartilage in it. Okay? Your knees have both hyaline and an extra pad of fibrocartilage called a meniscus in there. Okay? And then the other location is here, your pubic symphysis. The 2 bones coming together, especially since we became bipedal, it puts a lot of pressure right there. So that's a fibrocartilage disc right there as well. Does that make sense? So this one should be easy to identify as well. You guys cool with that? Okay. So, and then our last supporting connective tissue is osseous tissue or bone. There are actually 2 different kinds of bone tissue, but we're only going to learn one until the next set of notes. So here's osseous tissue or bone. What we're really learning, by the way, is compact bone. I'm going to start here because we're not going to do it late now, but we will also learn spongy bone. But we'll learn it in the next set of notes. Okay. All right, so I need to give you a big picture understanding before we actually start learning the parts of bone. So I want to tell you why it's called compact bone and what you're actually looking at in a histology slide, so it's not just rote memorization. So here's the deal. Compact bone is found on the outsides of all bones, but it's especially thick in the diaphyses or shafts of your long bones. And it's called compact because I want you to imagine that what you have is a whole bunch of little columns that are all running parallel to one another. You with me? Okay. Then you do a cross section of those columns, right? And then you're ending up looking at some circles. Why compact? Because they're all crowded right next to one another, right? Spongy, by the way, the reason it's spongy and not compact is because these are all running at different angles, right? So it's going to look like a sponge. Got it? Okay, for right now, all we're doing is compact bone. So we're taking this, right? And we're going to slice it, and we're going to see a cross-section of what looks like a whole bunch of trees. Yeah? So super crowded forest. And then we're going to look at one tree. Yes? A cross-section of one of those trees. So let's look at that. So the cross-section of one of these is called an osteon. And let's look at an osteon. Okay? So an osteon is one of those trees. Okay? And it's got a bunch of parts that you have to know in the osteon. Okay? So let's start out talking about how that osteon is going to get nutrients and oxygen and all of that kind of stuff. The trees are so crowded that there's really not room for blood vessels between them. So what they have to do is they actually have to have the blood vessels within them. So in the middle of each tree or osteon, there is this space called the central canal. But the central canal is important because that's where the blood vessels and nerves run. Okay? That's where the thing is going to get nutrients. You with me so far? Okay? All right. So then what's going to happen is let's look how the tree grows. Okay? The tree is going to grow in rings. How that thing got bigger as you got bigger is that I laid down one layer after another, right? Each layer is a lamella, plural is lamellae, and it's made of matrix. So let me back up for a minute and tell you what bone matrix is made of. Okay? Bone matrix is different than matrix of other things. So before we label the rest, let's big picture understand what bone matrix is made of. Bone matrix is kind of like reinforced concrete. Do you know what reinforced concrete is? What do you put down first when you have reinforced concrete? Rebar. And then you pour the concrete on top of it and it solidifies. And the rebar actually gives it strength, but it also gives it bend, right? It's going to bend a little bit before it breaks. So you want a reinforced foundation, not a not reinforced foundation. So here's the deal. The matrix is laid down in layers. I want you to think about this for just a second. The layers are made of collagen fibers, which would be made by the cells, yeah? And then calcium crystals. Where would you get the calcium crystals? Any idea? Where do you get calcium?
Milk.
Diet, yeah, you get it from your diet. So you make the collagen fibers, you get the calcium crystals from your diet, and then you're going to make it in layers. And how are you going to make it? Well, there are cells, right? The cells are at the boundary of each of the layers. So before we go further into the story, somebody tell me what the cells are called. Osteocytes. And they have to have a place to sit because this is a solid tissue. What are they sitting in? Yeah, they're sitting in lacuna. Now, the lacuna is usually not much bigger than the cell, but they have to have a place to sit because they're not solid and the tissue is, right? Does that make sense to you? Okay, so let's tell the story of how this bone was formed real quick, okay? How did I form this bone, okay? Nutrients came in from here, yes? And oxygen came in from here, yeah? With me? How did I get the nutrients from here to here? I have these little canals that go through the solid tissue. What are those called? Yeah, they're called Canaliculi, and what they are is truly little canals that go through solid tissue. Canaliculi, which means little canal. So I brought in oxygen and nutrients, including calcium from here. Yes? I'm going to deliver it all the way out to here, okay? Then this cell is going to use the nutrients and the calcium to make collagen fibers, yeah? Make it around itself, collagen fibers. Take the calcium, organize it into a crystalline form of calcium, and then dump it into the matrix. Does that make sense? And it's going to do it in layers. Good? Okay? So that's how this actually develops. Okay? Concept check question for you. If you don't get it, it's totally fine. What do you think this cell was called when it was super duper active in making matrix and wasn't really surrounded yet? Osteoblast, yeah. When it gets completely surrounded, it can chill a little bit, right? And then it's an osteocyte, exactly. So that's sort of the progression of bone growth. And what's happening is all of these guys are doing it, right? They're all doing it, and they're all becoming more and more compact as they do it, right? Okay? So that's what compact bone is. That's what it's made like. You will see later when we do spongy bone that spongy bone is almost the same. It's just they're running at different angles. And there's room for blood vessels between, so it doesn't actually have to come from the middle. Everybody okay with that? Okay. Now, this means, of course, that there's a jillion things that you can ask about that tissue. So that's one that you're going to have to spend some time on. And you'll get a double benefit of the time because you're responsible for that tissue again when we do bone next, right? So you might as well go ahead and get it out of the way now. Everybody good with compact bone? Okay. And then the last of the connective tissues is our fluid connective tissue. And the way that we teach it here is really easy. It's not actually that easy, but we don't make you learn very much about it until we actually get to blood. So the only fluid connective tissue that you have to learn is blood. And blood is easy at this point because basically you have to know that the matrix is mostly fluid. And what do you call the matrix in blood? Plasma, exactly. And then you've got 3 different cells or cell fragments. You've got the really abundant regular ones that are red. What are those called? Erythrocytes. You've got the less abundant nucleated ones. What are those called? Leukocytes. Now, these are not all the leukocytes that exist, but I will tell you that leukocytes are the ones, if you see anything with a nucleus in blood, it's going to be a leukocyte. Always less abundant, unless, of course, the person had leukemia or something, and then they would be more abundant. But, and then last but not least are these little bitty ones right here. Those are called platelets or thrombocytes, and those are primarily involved in clotting. Just to oversimplify, you'll get this in more detail later, but red blood cells are primarily about carrying gases around in the body. White blood cells are about defense and immunity, and platelets or thrombocytes are about clotting. And that's really all you have to know for that one, right? Okay, so last but not least with connective tissue is this. How do you know when you are done studying a connective tissue? So same thing that we did with epithelial tissue. So let's just talk about a couple of them and say, okay, I'm looking at this connective tissue. What freaking questions could I have to answer, right? So how do you know if you are done? Well, first, go further than most students do so that you will be more prepared. So when you're looking at any connective tissue, you need to be able to name the general category of connective tissue, right? So you need to know where it fits. So where does this one fit? Loose, be more specific. Loose connective tissue proper. Exactly, right? So I don't know how I would get you to write that unless I made it like a multiple choice question, because you don't know which order those go in, but I could ask you proper, supporting, or fluid, and then loose versus dense, and you'd have to choose all the things that were true, right? So just so you know, for me, I am neurotic about organization when it comes to intellectual material, not my car. It's a crap hole. But intellectual material, organization. So you always have to hold on to the organization. It will make it more easy for you to pull things up. Okay, next, of course, you have to be able to name the specific tissue, which is fine because that's as far as most people are ready to go. What's the specific tissue here? Adipose. But without looking up there, where does it fit into the story? Adipose is what? Connective tissue proper and Loose, and it's loose, right? Okay, so this is about as far as most students go, but let's go further so that you will do better. Any special structure. So, of course, this thing in here is a lipid vacuole, right? But there's a lot of special structures. So, like, what else could you have to learn? Well, there's a boatload of special structures in, well, here's one here. What's this special structure around the cell? Lacuna, exactly. And this little beastie right here, what's that line?
The canal.
That's the canaliculus, right? Individual is canaliculus, plural is canaliculi. I don't ding you on that one. Okay, what's this? No. That's the central canal, exactly. That's the central canal. So there's a whole bunch in that one. Identify the cells. Students do really poorly on this. I don't want you to be one of those, okay? So in connective tissue, you have to be able to know what a cell is called in that tissue. So let's just do a couple and see if you can get used to it. All right, so in this tissue, if I asked you to identify a cell, what would you say? Fibroblast. That'd probably be safest. You could also say interstitial cell. In this tissue, what is it? Adipocyte. Let's not ask that one. This tissue. Fibroblast. And this tissue. Chondrocyte, right, exactly. And this tissue. Osteocyte. Okay, so you need to make sure that you know what a cell is called in each one of those. This is always a fill-in-the-blank question on the first test, and it's just feast or famine. Some people are like, what the hell are you talking about when I literally talked about it for 5 minutes? They don't put anything there. Like, what is the most common or predominant cell type in this tissue called? And you're like, George. No, that is not his name, okay? But points for making me giggle. Identify the matrix region if you can, right? If there is a visible matrix, which is far more likely, of course, in loose tissues than in dense tissues, then you should be able to identify the matrix and or the ground substance. And then do not forget the dreaded specific body location. So for specific body locations, can you do them? What's a specific body location for this tissue? Subcutaneous layer. I like that. That's very good. What is a specific body location for this tissue? Tendons or ligaments. Almost all of them. So you don't even have to tell me a specific one, right? As long as you didn't say vocal cords or elastic ligaments of the penis or the intervertebral ligaments. What is a specific body location for this tissue? Dermis of the skin. Would you get credit if you just said skin? No, because we now know 2 tissues that are part of the skin, and actually 3, because it's actually got keratinized stratified squamous epithelium on the superficial surface, right? Then you've got a reeler, right? A little bit of a reeler connective tissue, and then you've got dense irregular connective tissue. Go ahead.
Why is dense irregular a part of the reticular layer, but not reticular, like there's loose reticular?
It's not reticular connective tissue. Somebody misnamed it. That's just like an anomaly historically. They're like, oh, I think this is reticular, and then they never changed the name.
Okay.
So, but that's a good question too. Okay, last one, and then I will stop torturing you with these. Name me a body location for this tissue.
External ear.
Yeah, it's external ear or pinna, which is what it's called. So you got it? Okay, so you're going to have to practice this. This will also be a fill-in-the-blank question, which means that you have to memorize one that's true, because I don't know which one you're going to memorize, right? So you can tell that you're going to have to write all of those in for any body location for any tissue. Otherwise, I have to make you memorize every single body location, right? Everybody good? Okay, so next ones we will do, and then we'll finish quickly at the beginning of next time, is we will do nervous tissue. It won't take very long. You're a couple minutes ahead of the other class, so I'll let you go. And then I want you to go ahead and plan on a long, relatively difficult take-home quiz over histology over the weekend. I'll put it up on Thursday. You can collaborate. It is open book, right? You can take it to Open Lab, try to get all the right answers. I want you to talk to each other. I want you to use your resources. I'm going to make it try to be a really good indication of what an A student would be able to do. Here's how take-home quizzes work, by the way. I will give you X number of days. When take-home quizzes are due, right after they're due, all the right answers will show up. So you can go back and check them, okay? But there's no cheating because there's no way to cheat if it's open book and open collaboration. I just want you to be able to use your resources. Cool? Okay. I will see you guys on Thursday.
Do you have a quiz on Thursday too?
Nope, I'm going to give you a take-home quiz. Because there's so much to ask about histology that I really want you to have a long one and not a short one.